Hello, good afternoon, everybody, and welcome to this Lunch and Learn series with the Navajo Department of Health, which is called What You Should Know About Hepatitis C. I am Leslie Stewart. I'm an infectious diseases physician, and I work at the Chinle Comprehensive Healthcare Facility, and I'm giving this talk with Dr. Gabrellis. I'm going to have her introduce herself as well.
Ya'athe, and welcome. Thank you for coming to our Lunch and Learn today about hepatitis C. I'm an infectious disease doctor at Gallup Indian Medical Center. I've lived and worked on the Navajo Nation and in Gallup since 2013. I started my career at Sohotso Medical Center in Fort Defiance in 2013, and then in 2021 came over to Gallup. And I am the director of the hepatitis C clinic here and also take care of people living with HIV and other infectious diseases. So thank you for coming today.
Great, thank you. So I am going to start by giving some background about hepatitis C, including what it is and how people can get tested to find out if they have it. And then Dr. Gabrellis is going to talk about what hepatitis C does to the body and how people can get treated and cured for hepatitis C. So what is hepatitis C? Hepatitis C is an infection caused by the hepatitis C virus, also known as HCV or Hep C. It primarily affects the liver, and it can lead to inflammation and sometimes severe liver damage. Most of the time, it does not cause symptoms, so people don't always know that they have it. How common is hepatitis C? It's estimated that about 2.4 million Americans are living with hepatitis C, and we know that the rate of hepatitis C is highest in American Indian and Alaska Native persons, and there was a 7.4% increase in hepatitis C rate in 2021 to 2022, while other groups in the country did show a decrease in the incidence of hepatitis C. And unfortunately, we also know that there's a 3.3 times higher rate of death in American Indian and Alaska Native persons compared to non-Hispanic white persons. And that's why we really want to talk about hepatitis C today and make sure everybody is tested for it, and if they have it, that they're cured of hepatitis C. So how do people get hepatitis C? It is transmitted through blood-to-blood contact. And so right now in the United States, the most common mode of transmission is injection drug use. And that's because there may be spread of blood-to-blood contact between either needles or other injection equipment. It is possible, though uncommon, for a mother to transmit hepatitis C to their child during birth. And it is also possible to spread hepatitis C through sexual contact. Another method of transmission is when people are sharing personal items that have contaminated blood on it, such as razors or toothbrushes, and also through unregulated tattooing and piercing. And by that, what I mean is sometimes when tattoos or piercings are done in a home setting or an unregulated setting where equipment is used for a bunch of people. It's also possible to get hepatitis C through donated blood or blood products, but this is really non-existent in the United States since testing for hepatitis C became available in 1992. But some people may not have been tested after they were exposed before 1992, which is why it's important that everybody gets tested. It's also important to know how people cannot get hepatitis C. Hepatitis C cannot be spread through casual contact such as hugging, shaking hands, or sharing food or drinks. So who should get tested for hepatitis C? It's recommended that all adults should get tested for hepatitis C at least once. Pregnant people should get tested for hepatitis C during each pregnancy. And some people should get tested more often, such as those who currently inject drugs and share needles, syringes, or other drug preparation equipment. Up to 50% of people who have hepatitis C do not know they have it, and most people living with hepatitis C have no symptoms, which is why it's important for everybody to get tested. So hepatitis C testing is done in 2 steps. The first step is an antibody test, which is usually done from a blood draw. And the purpose of this test is to check for antibodies for the hepatitis C virus And a positive result means that a person has been exposed to the virus at some point. The second step, if that antibody test is positive, is what's called a hepatitis C RNA test or a viral load, and that is conducted to check for the presence of virus in the blood. And if that is positive, that confirms that a person does have an active hepatitis C infection. And then sometimes when people have hepatitis C, they get additional tests, such as for liver tests and liver function. So how can one get tested on the Navajo Nation? It's important to know that all IHS and 638 healthcare facilities on the Navajo Nation can test for hepatitis C. And if you wanted to get a test, the best way would be to ask your primary care provider or any other provider that you're seeing to get a test for hepatitis C. And some of our service units do have walk-in express STI clinic, and that would be another way that you could get tested. So if anybody has any questions, feel free to put that in the chat. We're happy to answer questions. But right now I'm going to turn it over to Dr. Gabrellas.
Hi, I'm Dr. Gabrellas. I'm going to be talking a little bit about hepatitis C, what the disease can cause, and then how it can be treated and cured. Next slide, please. So what happens if a person does become infected with hepatitis C? At the time of the initial infection, a person may experience a very mild illness with few or a lot of times even no symptoms. Or in rare cases, it can cause a potentially serious condition that could require hospitalization. That initial infection is known by the medical term acute hepatitis C. Less than half of people who get acute hepatitis C can clear the virus in the first 6 months of infection without treatment. So sometimes people's bodies will be able to get rid of the virus on its own, but over half the time, the virus stays in the body long term and won't go away unless that person gets treatment and gets cured with medical help. Next slide, please. What are the symptoms of acute hepatitis C? It's really important to remember that most people have no symptoms at all when they get hepatitis C. And so that's why testing is really, really important. But if a person does develop symptoms, they would usually notice them about 2 to 12 weeks after the infection with the virus. And signs can include dark urine or clay colored stools, feeling tired, having a fever, joint pain, loss of appetite, or nausea, stomach pain, or throwing up. Next slide, please. What is chronic hepatitis C? So, as we mentioned before, most people who become infected with hepatitis C develop a chronic or lifelong infection. And if that infection is left untreated, chronic hepatitis C can go on to cause serious health problems like liver disease, liver failure, liver cancer, and even death. Actually, chronic hepatitis C is a leading cause of liver cancer currently in the United States and around the world. And it's right now it's the leading cause of liver transplants in the United States. Next slide, please. So, more about what is chronic hepatitis C. People with chronic hepatitis C are usually what in medical terms we would call asymptomatic, meaning they actually don't have any symptoms, or they might have really general symptoms like chronic tiredness or depression that a person may not notice enough that they would come to the doctor or would think could be due to a virus. Yet, the reason it's really important for people to get tested and find out if they have the virus is that even people that have no symptoms can spread the virus to others through their blood. And even without symptoms, the virus can cause significant liver damage, which can sometimes lead to cirrhosis of the liver. Next slide, please. What is cirrhosis of the liver? So, cirrhosis is a form of severe scarring of the liver that causes liver failure. And there are many different causes of cirrhosis of the liver, such as heavy alcohol use, for instance, metabolic and autoimmune conditions where the immune system attacks a person's own body, and infections. Without treatment, people who have chronic hepatitis C may develop cirrhosis of the liver. Next slide, please. How likely is hepatitis C to cause liver damage? So, among people with chronic hepatitis C without treatment, so who did not get medication and become cured, the research shows that about 55 to 85% would be expected to progress to chronic liver disease, about 15 to 30% would be expected to progress to cirrhosis, and about 1 to 5% would be expected to die from complications of cirrhosis or liver failure. Next slide, please. Another common question I am asked sometimes is what is the link between hepatitis C and diabetes? Chronic hepatitis C infection can increase the risk of someone developing diabetes. This happens because of the virus's impact on the liver, which is involved in storing glucose or sugar. If the liver cannot function as it should, it can lead to high blood glucose or sugar levels and insulin resistance. Some patients actually experience significant improvements in their blood sugar levels once hepatitis C is cured. So, some patients who have prediabetes don't have it anymore after their hepatitis C is cured. And I've had patients with diabetes who have to take lower doses of medication or sometimes are able to come off medication after their hepatitis C was cured. Next slide, please. So, what happens after treatment? Hepatitis C is treated with pills for either 8 or 12 weeks, and those pills have almost no side effects and are very easy to take. After treatment, a provider will check a patient's blood 12 weeks after they take their last pill to make sure they're cured. After successful treatment, it's important for people that have been treated to know that a person will still have hepatitis C antibodies detectable in their blood for life. This is because a positive antibody test means that a person has been infected at some point in time, not necessarily that they currently have the virus. A person whose body cleared the hepatitis C virus without treatment will also have detectable antibodies in the blood for life. Next slide, please. Another common question I'm asked sometimes is, can a person get hepatitis C more than once? Yes, unfortunately, the antibodies in a person's blood after they've had hepatitis C do not protect them from being infected again if they have another exposure. If a person is worried they may have been exposed again, an additional blood test called an RNA test is needed to determine if the person is currently infected with hepatitis C. A person who has hepatitis C again after they've previously been treated, fortunately, can still be easily cured again with medication. Next slide, please. So, is treatment for hepatitis C available in the Navajo Nation? Fortunately, the answer is yes. Some people may not realize this because in 2013, when the new medications for hepatitis C that are pills, not injections, became available, they initially were very, very expensive. And so, some people may have lived in places where they were told that these medications are very expensive, they have to come from specialists in urban areas and that they're not available. But fortunately, at this point in time, almost all IHS and 638 healthcare facilities on the Navajo Nation have hepatitis C treatment available. The few that don't will link patients to care at a neighboring facility. So the most someone might have to travel would maybe be from Crown Point to Gallup or maybe from Winslow up to Chinle, but treatment is readily available on the Navajo Nation. And the next few slides are going to list the contact information for hepatitis C treatment at each of the Navajo area service units. Next slide, please. Tuba City service unit. So for folks that live in Tuba City or use the Flagstaff or Lecce, Arizona clinics, for hepatitis C treatment, their doctors there recommend that a person would call the internal medicine clinic at Tuba City Regional Healthcare Center at 866-976-5941. And Dr. Lena Wong is the infectious disease specialist who works for Tuba City Regional Healthcare Center and provides treatment for hepatitis C. Next slide, please. Kayenta service unit, they recommend that if a person knows they have or thinks they have hepatitis C, that person would first go to patient registration to create a chart if they don't already have one. Then they would go to the directly to their lab for express STI testing, which will allow them to retest to confirm that they do have the virus and need treatment. And then they would request an appointment with Brenda Freeman at Clinic B by calling 928-697-4000, extension 4116. Next slide, please. Winslow Service Unit. Winslow Service Unit recommends that people who have or think they may have hepatitis C talk with a primary care provider at either Winslow Indian Healthcare Center at phone number 928-289-4646, the Loop Clinic at 928-686-6550, or Dilkon Medical Center at 928-657-1000 about being referred for hepatitis C treatment. Next slide, please. Chinle Service Unit for hepatitis C treatment, either ask your primary care provider for referral or call 928-674-7086 and ask to speak with Dr. Leslie Stewart, who's actually my co-presenter and did the beginning of this presentation. And she provides treatment for hepatitis C at Chinle Service Unit. Next slide, please. For Defiance Service Unit, Dr. Marek Marcinkowicz in the primary care clinic provides hepatitis C treatment at Sohotso Medical Center. Patients can call 928-729-8032 to schedule an appointment with Dr. Marcinkowicz. Next slide, please. Gallup Service Unit. Hepatitis C treatment is provided by me, Dr. Alethea Cabrales, my colleagues, Dr. John Yerlu and Dr. Kim Suk, in the Gallup Indian Medical Center Internal Medicine Clinic. Patients can call 505-722-1575 and ask to speak or leave a message with Dr. Cabrales, that's me, to schedule an appointment. Next slide, please. For Crown Point Service Unit, hepatitis C treatment services are coming soon at Crown Point Healthcare Facility. Currently, people who live in the Crown Point Service Unit can access treatment for hepatitis C at Gallup Indian Medical Center and can call 505-722-1575 and ask to speak with Dr. Gabrellis to schedule an appointment. Next slide, please. For any questions or comments, feel free to contact me at aletheagabrellis@ihs.gov. And I'm just going to respond to any questions in the chat. So it sounds like some folks had trouble with the sound and the pictures and slides were really small. So I guess I can maybe put this in the chat, but we could recommend for folks to turn their speaker up or to maximize their screen if they want to see it a little bit larger. And if anyone has any questions about hepatitis C specifically, they could also put them in the chat.
Okay, yeah, it looks like there's not any questions in the chat, but if anybody has any questions afterwards, you can feel free to contact either myself or Dr. Gabelis. Thank you so much for joining today.